Thanks for your time this morning. So those exposure sites at Dubbo and Moree, how concerned are you about that this morning?
Yeah, look, it is concerning. We've done very well out there. We had a couple of cases, 16 or 17 months ago at the start of the pandemic with cruise people coming back, and we've done very well. So those sites, the concern for me is that quite a lot of those, Moree and Dubbo, in my electorate are regional towns, and people do come from other places to do their shopping, and more likely have a cup of coffee or something on the way home. But I do know that those places are quite particular about the sign-ins and the seating arrangements and the like. So we're hopeful that it will be managed quite quickly. There's pop-up testing sites happening today, and we're just trying to encourage people to take the opportunity if they're in those areas or they've got any symptoms to take the opportunity to be tested.
This Victorian couple, should they face penalties?
Well, I haven't seen the full report, but on the surface of it, I know that the people in my part of the world are very angry at the moment that if as to what's happened, the disruption it's causing them. But I'll wait till I hear a full report on this. But I think that it's a stark reminder that how we still are really in the middle of this pandemic, and that we need to treat the health advice and the orders that are given very, very seriously. And if they're not followed, then there's consequences that follow.
How equipped are regions to be able to handle an outbreak?
Look, we've got good facilities, but if we got large numbers, then we don't have the level of intensive care beds and respiration and the like. We have in some of the more remote communities. We've got an arrangement with the Royal Flying Doctor Service for retrieval, and they've put in protocols on their planes so that they can move people around to areas where there are intensive care beds. But some of our smaller communities, I know the communities up at on the border, McDonald's at Gundawindi was a site, and a lot of my constituents at Boggabilla and Toomelah and Knowlestar and those places would more likely to pop into McDonald's and get a coffee or a burger or something on their way home from town. So those smaller communities, the only way that we can treat people there is to remove them to a larger centre. So it is better that we get on top of this quickly because if we get large numbers, then it is going to be more difficult to handle.
Okay, and what's the feedback been from regional when it comes to vaccination, in particular your electorate and other regional areas too, when it comes to vaccination? Is it where it should be?
Yeah, look, I think so. We're finding that as the supply comes through, people are stepping up to take an advantage of that. I've been to quite a few GPs, Aboriginal Medical Services, and I think country people, are aware that they are vulnerable, even though we've been incredibly safe over the last 15 or 16 months. And I think they understand probably better than most the issues around risk versus reward, and any of the smaller perceived side effects of having a vaccine are greatly outweighed by the benefits of protecting their communities. And particularly what I've been finding, Pete, is that the Aboriginal communities understand that they are vulnerable. They've got higher levels of chronic health issues, larger numbers of older people that are living in those communities. And so they've been taking up the opportunities to have their vaccine when the time comes, and I'm sure that will continue.
Okay, Mark Coulton, thanks for your time. We'll talk to you soon.
Thanks, Pete.